Thank you, Mr. President. The most important words in our Constitution are the first three words, we the people. That's the mission statement for the United States of America. It's written in big, bold, beautiful letters so that even from across the room, if you can't read the details, you know what our nation is all about. As President Lincoln summarized, a nation of the people, by the people, and for the people. Well, we have seen this year quite an assault on this vision of government of, by, and for the people, and it came in the form of President Trump's plan to rip health care from millions of Americans in order to deliver billions of dollars to the very richest among us. Plan after plan, version after version, wiping out health care for 24 million, wiping out health care for 23 million, wiping out health care for 32 million, and so on and so forth. Always over 20 million, and always delivering this enormous gift of hundreds of billions of dollars to the richest Americans. You know, you look at this from a little bit of distance, and it's just incredible to imagine that this could have occurred, that any member, a single member of our nation would possibly have supported such an outrageous, diabolical, dangerous, damaging plan to the quality of life for so many people across our nation. It wasn't just that it ripped health care from more than 20 million people. It wasn't just that it delivered billions of dollars to the wealthiest among us. It also ensured that those with pre-existing conditions wouldn't be able to get care. It was also that it would have raised our premiums an estimated 20% for those who were able to secure insurance. If one set out to design the worst possible health care plan you could ever imagine, you probably couldn't come up one as bad as President Trump and the Republican team came up with. It seems incredible that we're still debating the basic premise on whether health care should be part of a standard foundation for families to thrive here in this century. Every other developed nation understands that health care is so essential to quality of life, so essential for our children to thrive, so essential for our families to succeed, that they make sure that just by virtue of living in a country, you have that health care. Well, I have to salute the millions of Americans who weighed in to say that this diabolical plan needed to be dumped. They filled our streets and overflowed our inboxes and flooded our phones. They made it perfectly clear that health care is a basic human right, not a privilege reserved for the healthy and the wealthy. And I certainly agree with them. We decided collectively that we were not going to allow this diabolical plan to undo the progress we made. We made significant progress with Obamacare. After decades of being essentially unable to change the uninsured rate, we made significant progress. Well, there we are with a big drop in the uninsured rate, a big increase in the number of people who have access to health care. But we're not in that place yet where this number drops to zero. We still have 10% of our country that doesn't have insurance. And the costs are still too high. And the deductibles and copays are too high. And 1 out of 5 of Americans can still not afford their prescriptions. And in addition, we have this incredibly complicated set of healthcare systems. We have Medicare and Medicaid. We have on-exchange. We have off-exchange. We have children's health insurance program. We have workers' compensation. We have self-insurance. And we have a multitude of varieties of health care through the workplace, some covering just the individual, others covering the entire family, some covering just a small percent of the health care costs, some more. Some are certainly so complicated, even the folks who have them aren't sure what the insurance company should pay. So we found in this conversation with Americans about health care that Americans weighed in very strongly about the stresses, about the challenges of ordinary Americans to secure health care. It's an ongoing, lifelong effort. Do you have an employer who covers you but not your children? Can you get them onto the Children's Health Insurance Program? Do you have an insurance plan at work that you have to contribute to, but the costs are so high of contributing that you really can't afford it, and do you opt out of that, and then what happens? Or perhaps you're under Medicaid, up to 138% of income for those states that have expanded Medicaid, and yet you gain a small increase in your pay, and maybe now you don't qualify. In the middle of the year, can you apply to the health care exchange? Will you get tax credits credited to you? Or will you have to pay a big sum at the end of the year when your taxes are reconciled? It's continuous application. It's continuous change. It's continuous stress. Why do we make it that hard? Now, my 36 town halls a year, one in every county in Oregon, mostly in red counties, because most of the counties in Oregon are red counties. I have had people coming out yearning for a simple, seamless system that says just by virtue of being an American, you have health care when you need it and you won't end up bankrupt. What is that vision all about? It's about taking an existing model, one that has worked so well for our seniors, the model of Medicare. Now, folks used to come to my town halls and they'd say, I'm just trying to stay alive until I reach age 65 so that I can be part of that wonderful health care plan, that Medicare plan. So this is a well-known commodity. I've heard some of my colleagues mocking it the last few days. Well, certainly, maybe they should get out and have town halls. Maybe they should talk to our seniors about how well this system works. Maybe they should recognize that the overhead costs are much lower, 2% versus 20% and sometimes much more in private insurance health care. That's more than a fifth of our health care dollars simply wasted, a waste that disappears with Medicare for all. This is a type of health care system that addresses and changes this enormous fractured and stressful system. We currently spend twice as much as other developed nations per person on health care. Twice as much as France, twice as much as Canada, twice as much as Germany, and so the list goes on. And yet, the health care we receive provides less health in America than in those countries. We should be ashamed that our infant mortality rates are higher, even though we spend twice as many dollars per capita as those other countries. So it's clear that there's significant room for improvement. And by the way, there's so many opportunities to move in this direction. Now, we've laid out this Medicare for All plan, and I salute my colleague Bernie Sanders and the additional co-sponsors. There's now 17 senators who have said, we are co-sponsors of this because we know that it addresses the fractured, stressful nature of our current system. We know that it's more cost-effective than our current system. We know that it will lead to greater peace of mind than our current system. And shouldn't peace of mind be what we're all about? That is, the peace of mind that if your loved one gets ill or injured, they'll get the care they need. The peace of mind that if your loved one is in an accident, they'll get the care they need and you won't end up bankrupt. It's time for America to have this conversation. And it's my intention, certainly, to have this conversation with the citizens of Oregon. And I encourage my colleagues to have this conversation with their citizens. How can we move to a system which you can stop worrying about whether or not you'll get the care you need, your loved ones will get the care you need, and you won't end up bankrupt when you are sick or injured. That is the goal. Let us have that conversation in America and keep considering pushing towards making it a reality. I'm proud to sponsor this bill, and I certainly am proud to fight for quality, affordable health care for every single American because it is a basic human right.